Hello everyone, I'm Dr. Andy Kuhn and I want to invite you to join our healthcare team as we serve in Santa Ana, El Salvador, March 14th to the 21st, 2015. Dr. Craig Amnett, a family physician from New York, will be our team leader. I'll be serving as a medical director and helping to coordinate students who will be rotating at the different clinic stations. We've scheduled this trip during the week of the IU spring break. This will give you an opportunity to be mentored by local physicians as well as other healthcare professionals from all over the U.S. Not only will you gain valuable clinical experiences on the trip, but you will also learn how to share your testimony and how to pray with patients. No Spanish skills are required as the Oasis churches provide translators for us. Additionally, scholarships will be provided to selected IU students who apply to help offset the trip cost. So why go on this trip? We will certainly be able to provide health care to the underserved. Last year, we provided health care to over 1,800 patients. We dispensed over 3,000 prescriptions and provided 51 needed dental extractions. We also saw over 300 eye patients who received glasses. However, more important than that, our healthcare ministry provided us an opportunity to share the gospel message with all of these patients. As a result, there were 98 new believers added to the kingdom, and 15 others rededicated their lives to Jesus Christ. I want to be part of a healthcare team like that, don't you? Jesus instructs us to make disciples of all nations. This is part of the exciting purpose God has for your life and is already planned for you. Let me introduce you to the Oasis churches. They have a vision to reach all of their surrounding communities in Santa Ana with the gospel message. They do this by having medical campaigns in the church plants that surround the city. This introduces the community to the local church and provides an opportunity for much needed medical services as well as an opportunity to share the gospel. Additionally, they have sent missionaries all over the world and have been partnering with GHO for over 10 years to make these medical campaigns possible. Months of advanced planning have occurred prior to our arrival. Everything from lodging, travel, clinic setup, and meals are coordinated by the Oasis churches. Oasis de Gracia has a school that provides interpreters for our trip and also engages their youth in outreach ministry. We hit the ground running upon our arrival in Santa Ana. After our travel from the airport in San Salvador, we will meet our ministry partners at one of their local churches. This is an inspiring time of celebration and prayer for all that the Lord is going to do through His ministry during the coming week. Additionally, there will be time for formal introductions with your team members who are coming from all over the U.S. We will also be introduced to local healthcare professionals from El Salvador who will discuss the common conditions that you will be treating in their communities. They also serve as a great resource for getting patients plugged into the local healthcare system. This is especially important for healthcare needs that are too complex for us to provide. Local professionals also serve as a point of contact for ongoing medical continuity. What an awesome example the Oasis churches are of being the body of Christ. There are a variety of clinic sites and transportation will be provided to each of these. You will spend approximately 1 to 2 days serving at these sites. Now, the clinical areas are divided up into 7 segments, and you will have the opportunity to serve in each of these. Students enjoy rotating through each of these areas as it allows them to provide services to the patients as well as for us to provide adequate supervision. In the triage area, you will be the first person to see the patient. You'll take vitals and find out their primary purpose for their visit. This helps with directing patients to the appropriate area for the services they need. In the pharmacy, you work with a licensed healthcare provider who will teach you about all the medications that you will be dispensing. Additionally, they will teach you and train you on the techniques for patient education, as this is critical for proper medication administration. Our eyeglasses station will not be performing dilated exams, but does provide a variety of over-the-counter magnifiers. We have eye charts as well as Spanish literature to help with decision-making for which pair of glasses are right for the patient. Medical stations allow for students to practice taking a history as well as performing physical exams and discussing a differential diagnosis under the supervision of licensed providers. The dentistry station is limited to dentists who are on the trips, but you can provide additional assistance that is needed with instrument processing and sterilization. We will have ongoing children's ministry and evangelism that you will have the opportunity to participate in. We encourage our teams to bring along activities for kids who are waiting with their families during their appointments. Teamwork as the body of Christ is what makes these trips successful. The Lord instructs us to pray for His kingdom to come right here and now. He wouldn't ask us to pray this prayer unless He was going to do just that. Join us as we provide excellent health care and proclaim the good news of the gospel together. The next steps at this point are for you to go ahead and Google the Service Reef website and GHO to sign up for the trip. You'll see the fee schedule there, and it will also explain more trip details. Please feel free to contact Dr. Andy Kuhn at the email address on the slide. And also, I'm willing to answer any questions that you might have, as I'm sure many will come up prior to our going on this trip. Also, I want to encourage you to visit our Central Indiana CMDA website for more information. I look forward to serving with you on the trip.